Hello and welcome to the August 24th Virginia Opioid Abatement Academy. Ms. Jennifer Nelson, Virginia Institute of Government, Assistant Director for Membership and Engagement. The Institute of Government is the leadership development and community engagement arm of the Weldon Cooper Center for Public Service at the University of Virginia. Through our research, leadership development programs, and local government engagement initiatives, we continue to work toward our vision of good governance, equity, and resilience in every Virginia community. VIG offers leadership development through SEI and LEAD, local government equity clinics, certification for treasurers and commissioners of the revenue, and customized training programs. State agencies and local governments can access a range of consultation and support services to build more resilient organizations. We have a team of seasoned public sector leaders and subject matter experts ready and available to facilitate boards of supervisors, city and town councils, leadership team strategic planning retreats, and other related events. Today, VIG is glad to partner with the Opioid Abatement Authority for the Abatement Academy series presented every second and fourth Thursday through 2023. Here are a few housekeeping notes. This session will be recorded and posted on the Weldon Cooper Center for Public Service YouTube channel soon. If you have any questions, please type them in the chat and I will ask them for you. Thanks again for taking the time to join us today for this Abatement Academy session. Now I'm happy to turn things over to Tony McDowell, the authority's Executive Director. Tony?
Good morning. Thank you, Jennifer. Welcome everyone to this episode of the OAA, Opioid Abatement Authority Abatement webinar. So we're very pleased, and it's my pleasure to introduce our guest speakers this morning from Fairfax County. We have several speakers. The first is Ms. Ellen Boa. She's the Fairfax Opioid and Substance Use Task Force Coordinator, where she coordinates Fairfax County's multi-pronged cross-systems opioid response strategy. She brings a background in public policy, government affairs, and consulting. Ellen is joined by Mr. Stefan Mastel, who's Fairfax County Public Schools Student Safety and Wellness Coordinator. Stefan is a former assistant principal and prevention specialist, and he provides education, prevention, and intervention strategies throughout the division's K-12 programs. Highlights of his areas of expertise include youth substance use, bullying prevention and response, student mentoring, and gang prevention. And finally, we have Raymond Adden, who is the program manager for the Fairfax County Wellness, Health Promotion, and Prevention team within the Fairfax Falls Church Community Services Board. He's a facilitator in various prevention initiatives, including mental health first aid, opioid overdose naloxone education, Revive, Talk They Hear You, Question, Persuade, Refer, QPR, and Adverse Childhood Experiences, ACEs. Raymond has a counseling background with experience working in mental health, substance misuse, and prevention strategies. And behind the scenes of the Fairfax team is Brian Anderson, who's with us this morning to assist the rest of the team with their presentation. And so we really appreciate the folks from Fairfax taking the time to develop this presentation for this webinar. And with that, I'll turn it over to Ellen. Thank you.
Good morning. Thank you for having us today. So just briefly, this is kind of our roadmap for today. I'll talk a little bit about Fairfax County's opioid response strategy overall, just so you can kind of see our overall strategy and where our prevention work fits in. Then I'll turn it over to my colleague, Stefan, who will talk about school-based prevention initiatives. And then Raymond will talk about our CSB-led prevention initiatives. So again, really high-level overview. Fairfax County has had a targeted kind of strategy to address the opioid epidemic since about 2017. So today we have about 40 different programs and activities underway across a spectrum of everything ranging from prevention, so starting misuse before it ever happens, and then going all the way to recovery, and everything in between. So a lot in the way of public safety partnerships, obviously early intervention and treatment, a lot of data and monitoring, and then of course, work in our criminal justice system. And so it's a really big kind of countywide effort. We have over 15 different county agencies involved and several other stakeholders as well. So all of this work, is working together towards the goals that you see on the screen before you. That's to reduce opioid-related deaths, improve the quality of life of individuals impacted by opioid use disorder, and then, of course, to use data to really describe and define the problem and then target our interventions. So historically, for the first, several years of our work, we saw most of the overdoses occurring in individuals 18 and above. And a lot of our youth-focused activities were in the education and prevention space. Well, the last couple of years have kind of changed that because of the trends we're seeing, which I'll talk about in a moment. And so now we're in this space where we're really recalibrating to build out youth activities across the spectrum. And again, I'll talk about that more a little bit later. So just to give kind of a snapshot of what we see in Fairfax when it comes to opioid overdose trends, this is a screenshot from a dashboard that's publicly available on our website. You can see the links on the right-hand side. It's led and managed by the Fairfax Health Department. And this uses two different public health data points. The blue line is emergency department visits for opioid overdoses in the Fairfax Health District. The orange line is opioid overdose fatalities, and that comes from the Virginia Office of the Chief Medical Examiner. And so for both of those data points, it's the Fairfax Health District, which includes the county of Fairfax, as well as the cities of Fairfax and Falls Church. And so you can generally see how our numbers have been trending kind of overall. This is for individuals of all ages. The line graphs are on the top of the screen. And then on the bottom, you can see kind of the age breakdown. I do just kind of want to underscore that, we have had a significant number of opioid overdose fatalities in our community, nearly 700 from 2016 through the first quarter of this year. And so our community is really profoundly impacted by this opioid epidemic, which is why we have, so many activities working to address it. So here are just some of the examples of what we have underway. And this is a slide that kind of shows activities targeting, I'd say, sort of the general population, individuals of all ages. We have had a communications campaign. We have a Fairfax Prevention Coalition, which kind of, is a space where we can work with a lot of different community partners on prevention initiatives and other initiatives. In the early intervention and treatment area, we have a number of medication for opioid use disorder programs, including one that's jail-based that we're really excited about. And that quote in the blue kind of describes that program. It's a partnership with the Community Services Board, the Sheriff's Office, and the Chris Atwood Foundation. We also have the police department has an overdose investigation unit. And then in our fire and rescue department, they partner with the CSB to do kind of leave behind Narcan at the scene of overdose calls. And the example that we have in sort of the recovery category today is a team of peer specialists with lived experience. It's our peer outreach response team. And that's available to kind of anyone in the community who's seeking some peer support. So we've had all these activities kind of underway for several years. When we first started to notice an increase in youth opioid overdoses, it was actually our public safety partners who really helped raise the concern about that. They have kind of boots on the ground, ability to track emerging trends. And so I just wanted to note that, because even if your community doesn't have a lot of these different programs with positions associated with them, just partnering with public safety can really help identify emerging trends, which then kind of filter back to what you do in the prevention space. And so here's some data on what we're seeing in terms of emergency department visits for opioid overdoses among youth. And so, it was back in late 20 in like the 21-22 timeframe where we had our public safety partners say, hey, we're identifying a concerning number of youth opioid overdoses. And so that's kind of what kicked into action a lot of different activities. And then as we, continued working on prevention activities, on treatment activities, we started seeing the public health data, like this emergency department visit data, really start tracking and showing this concerning increase in youth overdoses. And so again, this is data that comes from emergency department visits for non-fatal opioid overdoses. It comes from the Essence system. It's that same data I showed a couple of slides back, but just kind of focusing in on the youth. So some of the activities that we kind of started working on or leveraged that were already in place are on this slide. The SAPS program is a school-based program that my colleague Stefan will talk about. Stefan and others in FCPS did a tremendous job rolling out Narcan in a really quick timeline throughout the school system. We've done and still are working on doing a lot of trainings, presentations for community members, for professional staff, a lot of public messaging. We did put in place, we have a post-overdose outreach process for adults. And also for youth now, where when public safety encounters someone who has overdosed, they refer that person over to our community services board for follow-up and an offer of, hey, how can we support you in your recovery journey? And so that has been really important. And then kind of the really big bucket of work that has been extremely challenging is enhancing and expanding local treatment options for youth with substance use disorder. There are just, as this CNN article on the slide shows, there just are not enough providers for youth who are experiencing substance use disorder, particularly opioid use. And it's really challenging. So locally, what we're doing is trying to build out that continuum through several different means, trying to partner with providers through purchase of service, trying to build out some services and pilot them in-house at the community services board. And then we also, in Fairfax, we partnered with the CSBs in the rest of Northern Virginia to put forward an application to the OAA for a cooperative grant award for funding to bring, youth substance use disorder withdrawal management and residential treatment services online in the Northern Virginia region. Right now, there's unfortunately no provider for that within Northern Virginia. And so we are seeing families having to travel several hours away for that. And so we're really grateful to the OAA for recognizing that need and awarding us those funds. And we look forward to making that available to the community soon. So with that, I'm happy to answer any questions about overall what we're doing in Fairfax County, this multi-pronged approach. But recognizing that today we're here for prevention, I'll turn it over to my colleagues, Stefan and Raymond, to talk about what they're doing in the school system and the CSB. And just know that we also have a lot of other prevention work happening in our other agencies as well. So with that, Stefan.
All right, thank you so much, Ellen. Good morning, everybody. My name is Stefan Maskell. I'm with Fairfax County Public Schools. And I wanted just to take a few moments to share with you some of the prevention and education and some of the intervention programming that we have within the school system to support our students and families. You heard Ellen speak briefly regarding our SAPS program, our Substance Abuse Prevention program. And essentially what that program is that we have substance abuse prevention counselors based in each one of our high schools. And while they are physically based at the high schools, not only do they support that specific high school's alcohol and other drug prevention and education and intervention work, but they also extend those same services down to the feeder elementary and middle schools as well. You'll see here that we have 3 tiers outlined on this slide, and that's really the way that their work is sparsed out. Tier 1 is any type of work that they do that has the capability to reach a large percentage of a population, whether that's the student population in the school, or the parent population, the staff population, or just the general community population. So some examples of that tier 1 work is pushing into our health and our PE classrooms, or pushing into other core content classes to provide supplemental information regarding substance use that would guarantee them face-to-face time with large groups of students. We also provide 11th grade alcohol and other drug prevention lessons to all 11th graders, and I'll explain why I highlight the 11th grade on the next slide. We also partner with our school PTA presidents to provide parent presentations as well. And then throughout the year, various, whether it's private organizations and agencies or local government agencies, public sector agencies will contact us and ask for us to provide information to them as well. And so all of those opportunities fall into that tier 1 sector. Tier 2 is where we are able to really drill down and work one-on-one or in small groups with those students that have been identified as at risk for substance use. And there's really 2 ways that students come to us or can be identified to be at risk. Either one is they have already lodged an infraction in terms of our alcohol and other drug school policy, all right? So you can think of, the young student that maybe was found to be in possession of a beer on school grounds at a football game, or you can think of the middle school student who went into the bathroom and had a vape pen, right? So, they clearly were not following school rules. So that's one way that those students come to us. The other way is students may come to us through their own self-referral, right? You may have a student who is smoking and they want to quit, but they are having some challenges and they just want to come down on their own and have a conversation and figure out what supports are available. You may have a parent who has gone into their son or their daughter's bedroom over the weekend and they found some marijuana. And they're now reaching out to the school system because they would like to know what type of supports are available. Or you may have a group of students in the hallway at school one day and they're talking about their weekend plans and a staff member overhears the conversation that includes the use of substances. And so that staff member can also make a referral for those students to meet with their substance abuse prevention specialist in their building. But regardless of how the students come to us, we are able to provide that student with a brief screening to help us get a better understanding of the level of involvement that student has with that substance. And then from there, our specialists or our counselors, they're able to put together a very targeted intervention or education strategy for those students. You'll see there at the tier 3 level, this is where we have students that we've come across that we recognize have needs that go beyond what our specialists in the school buildings can meet. And so Ellen had spoken earlier about young people that may find themselves addicted to some pretty significant substances, opioids, fentanyl, heroin, things of that nature. But we're also talking about young people, that find themselves drinking regularly on the weekends, and they're not always making the safest decisions, right? Perhaps they are not only drinking, but perhaps they may also be driving, or perhaps they need a ride home and they decide to get into the car of somebody who has been drinking, right? So all of those are signs and symptoms that there is some a level here of involvement that goes beyond what we can meet in the schools. And we are fortunate enough to have a relationship and a partnership with our community services board, where essentially we are able to expedite the process of getting a student enrolled in one of their more intense therapy options and other strategies. So that encompasses the work that our staff do through that three-tiered system of approach. Ellen, can you go on to the next slide, please? You'll see here on this slide that there are a variety of other strategies that have been put in place within FCPS to further support the work of battling this ongoing opioid crisis. That first bullet there speaks to the fact that all students in FCPS K through 10 receive alcohol and other drug prevention and education material through their health and their PE classes. So all students already receive that information. Because health and PE is not required at the 11th and 12th grade level, we do have lessons specifically around alcohol and other drugs for 11th and 12th grade students. And there's a variety of different ways that we're able to get those lessons to those students, even though health and PE is not required. That second bullet speaks to our SAPS program, and I already spoke in depth about that program. Unfortunately, we have had some overdose situations on school grounds last year and the year before. We were fortunate enough to be able to put together overdose response protocols. So all schools have access to these protocols, all administrators have received these protocols, and they really are in place not just to respond in the immediate time frame to support a student who may be in the throes of an overdose, but they're also designed to provide support to that student and that family once that student recovers from that overdose and comes back to school, and a plan can be put together to support that student as best the school can. We've also updated our policies and regulations. All FCPS schools have been stocked with naloxone. We've also updated that regulation to allow for students to carry naloxone on their person on school grounds. They do have to demonstrate that they have completed a Narcan or a naloxone administration training, and then both the student and the parent has to sign off on understanding the responsibility of carrying naloxone on school staff. On school grounds. We've also ensured that groups of our school staff have been trained to administer naloxone. So, for example, our safety and security folks are trained, our administrators are trained, our bus drivers have been trained, our coaches and athletic trainers have been trained as well. And our teachers certainly have the option to also become trained as well, whether it's through some of the availability through FCPS or availability through our CSB. They also have the availability to get that training as well. We are also currently working to stock naloxone on our buses. Currently, we are in the process of planning to have our more at risk or high need areas to be stocked with naloxone, while we are working to secure a certain amount of naloxone that would then be able to stock the rest of our fleet. We also provide ongoing community education, and typically that's going to be in the form of presentations such as this, where we partner with various other agencies, whether it's the CSB, our police and our fire and our rescue, our health department, our opioid task force in Fairfax County does a fantastic job of putting together events like this so that community education can be ongoing. And at this point, I'm going to turn it on over to my colleague Raymond from the CSB.
All right. We can move on. There we go. All right. So first of all, good morning, everyone. My name is Raymond Payton. I am the program manager for the Wellness, Health Promotion, and Prevention Program. I'm going to take you through a little bit of what we do and how this particular slide relates to everything I'm going to talk about. So in terms of our mission is to strengthen our community's emotional health and ability to handle challenges related to mental health concerns, substance misuse through trainings, workshops, presentations, and campaigns. So all of what I'm saying is all tied back into that directive. Next slide, please. All right. So when we go into prevention in terms of community, I'm just giving a working definition. So mental health and substance misuse prevention is defined as intervening to minimize mental health and substance misuse problems by addressing determinants of mental health and substance misuse problems before a specific mental health or substance misuse problem has been identified in the individual, group, or population of focus, with the goal of reducing the number of future mental health and substance misuse problems in the population. In short, to summarize, when we want to get to issues before they become issues that require treatment. And that is the goal, is how do we catch people? Because you can't get everyone. This is the one thing that I tell any area that I work with in any place in the world. You can't get everyone, but you want to get as many people as possible to have the information, prevention information, having the education, Because once you have the education, you are then allowed to make an informed decision. If you don't, this is what happens with a lot of our young people. They don't have the information, so they make decisions based on, you know, what their peer group or what, you know, information they do have access to. And that doesn't always turn out to have the best result. Next slide, please. All right, so when we look at strategies, right, because a lot of times we want to look at, you know, what works, what doesn't work. I will tell you some ineffective strategies. Scare tactics do not work. There's no data. I hope anyone who's into this, interested in doing this type of work, there's no data that suggests using scare tactics will work. A lot of times we do things that are one-time events. The issue with that is it lacks consistency, right? So it lacks consistency when we're doing things. Personal testimonies, say from someone in recovery, those don't always have the impact that people think they do. It's not that they don't help, but you got to always know who the audience is, right? You have to know who your audience is. Reinforcing exaggerated social norms, like, you know, saying that, oh, there are high rates of use, and that may not be factual. You have to tell young people when you're engaging with them, how do we make sure we're talking to them? We want to let them know what the truth is. Yes, there are overdoses, they're fatal. These things are happening, but what is the realistic numbers, and how does it impact all communities to make it make sense? When you appeal to people, when you can appeal to people, is when you can let them know, especially with young people, they want to see something that represents them. If you run a video of somebody who is, you know, homeless or living in the street, and they have marks all up and down their arm, they're not going to relate to that because that's not them, that's not their peer group. So that kind of strategy is not going to be effective for them. Fact sheets are great for parents. They're great for parents, but they're not great for young people. They want to connect with the material. They want to see how does it impact them. So some effective strategies in prevention are building social and personal skills. Right? What are you doing well? How do we improve on what you're doing? Right? What decisions have you made that are good? Because reinforcing the positive helps them make better decisions. Cite immediate consequences. Like, you know, young people, what do you do? When you're young, you start liking other people. You want, you know, smoking, your breath will smell, right? Your teeth will stain. These are real immediate consequences that impact you directly. Those are the type of things that young people buy into because they can relate to it. Communicate positive peer norms. Again, what are young people doing right? We have to address the issues, right? We have to address the issues that, you know, that impact young people. But, you know, there are young people who are peers who are doing positive things. Most important thing you're gonna probably hear me say as a part of this is involve youth. If you're looking to work with youth on any level and there's not a youth in the room, do not get upset when you don't get the results you want. Reason being, we come in, and this is to all groups, when we come in to help a particular group, we come in and our intentions are right? They're good, but we come in and we're telling people, this is what you need to get help. And you say, well, I got to tell young people what to do. Well, how are you going to tell young people when it impacts them without them in the room? Listen, the world you want to say that you grew up in, and you try to give that to your kids, that world does not exist anymore. It is gone. Whatever experience I had, and I'm not going to say the year, you know, I don't want to date myself. I'm a little older now, but the world I grew up in, some things are similar, but it is not the same. So you have to prepare them for the world they live in. In order to prepare them for them, you have to involve them to find out what's going on in their world. And so interactive approaches, you know, giving youth opportunity to learn skills, right? We can tell them something, but how do they practice? Let me give you an example. Just some people can't relate. I'll date you. I know if you recognize what I'm saying, I'm going to date you right now. I was young. They had a campaign, right? It was called Just Say No, right? In my community, just say no. If you said that to somebody, you might get hurt. That was a joke. That wasn't a serious thing because it was not relatable in the environment. Because people were like, well, what am I going to say yes to what? Right? Was it a good campaign? In some communities, in the one I grew up in, no. I would have never said that in any approach because that's not an opportunity. And they would have all kinds of assemblies. You say this in your community. I'm like, listen, you say that in the wrong place, this will have a bad result. Right? So you have to give them realistic ways to interact and hear that feedback I just gave you. So as you're building an approach, right? As you're building this approach, it makes sense. All right, next slide. Please. Don't like to be like, just do it. All right, so some successes We've had increased engagement in communities where there are limited resources with the intentions to build consistency, which improves trust. Lack of trust from young people, lack of trust from their parents is a big reason why people don't engage in services, not just with the CSB, but services across the board. The only way we can change that is to consistently be in areas frequently, right? So we should be recognizable. You see me somewhere, you'll see me enough. If you want to be seen so much, people get tired of seeing you. But that's how you build the trust, right? And building that trust will allow your messaging to be received a little bit better. We focused on increasing inclusion, but I just talked about of youth participation, and that's what we're really working toward. And you'll see as we go into what we're working on is to make sure that we are increasing youth participation in what we're doing, involving them in things that are about them. They're saying there's nothing about us without us, right? So we want to make sure that they're present. One of our strongest things we've done is our partnership with other health and human service agencies and agencies across the board. I use health and human service agencies because I work for the CSB, but whether it's the fire department, the police department, we are engaged on every level with everyone because the goal is to build community. And every one of our partners have some part to play in our community. So some specific challenges we've seen is having specific programming, right? And this is from a CSB standpoint that is, that impacts youth directly, right? That is strength focused because we want to make sure we are building their strengths and relatable. We want to have stuff that's specifically for them because program we had previously, it was just saying, hey, we have this, and it's great to say stuff is evidence-based, but it is evidence-based for whom, right? Again, knowing your audience. What is it about? Because all communities are different, so the needs are different. So you have to be engaged with your particular community to understand what is the youth in your environment need. So again, having youth participate in the conversation, working in silos. That's the thing. Fairfax County is a large area, right? It is a large area, and sometimes as groups we can get kind of caught in the work and doing our own thing. We can do more together than we can do apart. We can. And one of the things we committed to that is a challenge is engaging in youth 5 to 12 years old. Why is this important? Because they're being exposed. They're being exposed. Whether people want to talk about it or not, I talk to parents all the time. Whether we want to have discussion or not, they are being exposed. They know the drugs that are in communities. They know where to get firearms in communities at that young age. Whether you talk about it or not, it is happening, right? It is happening. Next slide. All right, and this is just some of our initiatives that we do. Lift Up Virginia is a campaign that you'll hear more about probably in the next year. We're finishing up the website, and what it is, it's about building resilience. Where can people, youth and adults, go to talk about their experiences with resilience? What is working? How do people get hope, right? How do we provide hope? What is working in certain environments? One of the programs you'll see, I gave some examples about some stuff we have done in the past is Photo Voice. We used the Photo Voice program, and what we did with that, what that entails is we had a bunch of young people, and we went from a mental health perspective who worked with us, and we discussed what does resiliency look like in your community in the form of doing through pictures, right? Having a visual. And we went through this whole process. It was a beautiful process where we met with young people. We discussed their pictures. We gave them, control over what they wanted to represent them. We provided them with their own cameras. And we had them go through this process like you were doing at the end, we did a presentation where they chose their best 6 pictures, right? Out of maybe 50, they had to narrow it down to 6 and what they wanted to share, which would represent them in the public. Owls Pals is another one. It is about young people. It's done with puppets, about making healthy choices, right? We have to start young. And it's a school where we partnership with school programs and introduce that. So it just increases our awareness. I'll just go through one more. As I Talk to Hear You. Talk to Hear You is a SAMHSA program, right? That we kind of made it into a presentation to talk with families about how to have a conversation with your young person about drugs and alcohol, right? Because again, I'm in the community a lot. One of the things I hear about all the time is, how do I have a conversation with my young person, right? And it's scary because we can talk about a lot of things, but I will tell anybody on this call, one of the most effective ways, listen, everyone on here, if you have children, you love your kids, right? Easiest way to start a conversation, listen, I love you, but I've been hearing some things going on in the community. I'd like to talk to you about it because I got some concerns. You've now started the conversation. It's not about having a perfect conversation. It is about having continuous conversation, but you just want to open the door. And if you open the door, a lot of times your children will walk right through, but you have to open that door. They're not going to do it. That's not their skill set. And it doesn't have to be yours. It doesn't have to be perfect. It just has to happen. Next slide, please. All right. So some ways we work with youth in the Fairfax County area. So we facilitate trainers in the community and in schools. So we will go into, as you heard Stefan say, we will go into FCPS. We will train young people. They're invited to come to our community groups. You'll see as one of the examples, I'll give you a quick one. One of the groups that we got involved with, Boy Scouts of America, right? We got involved with Boy Scouts of America because there was concern. They were hearing about the opioid crisis, but really wanted to know what did that entail. So we started, we do regular trainings with them, engaging youth at community events. We consistently try to go to as many events throughout Fairfax County as possible. Again, so we're consistent, and also so we can build trust. And so we also have Fairfax. You heard about our Fairfax Prevention Coalition, where we'll be this year working extremely hard to make sure that we have youth engagement. So we're supporting initiatives in the community that directly impact them. Working and supporting initiatives that are specific to youth, like Photo Voice, what I just mentioned, just making sure we are doing things that directly engage, and there's opportunity to create dialogue for them. They have a voice. And partner with other public safety, health, and human service agencies. That's another way we partner. That is, I will tell you, is a very impactful, because then there's a level of consistency and togetherness that we want, but the community also sees. Next slide. Just some of our partners. We have a lot. Put them on, but I want to get some. So as you can see, the health department, public schools, fire department, sheriff's office, court systems, faith-based organizations and faith-based organizations across the board. We are, if it's a faith-based organization, we are currently trying to build those partnerships, because in the past they weren't as receptive to the kind of work we do. But now, with the change in times, we are getting more invitations to come in, and I am trying to accept as many as I can get into with, as I said, some others, our Fairfax Opioid and Substance Use Task Force, and our FPC, and our equity team, because we want to make sure we are touching on all levels out here. Next slide, please. All right, so how do we communicate? How do we collaborate with our partners to serve youth and families? Again, we're consistently at community events. So we're at town hall, school events, resource fairs, wherever we can go. I'm at wherever you call and you need us to come and we have availability, we will be there. We facilitate trainings for our community partners, such as FPC, Fairfax County Public Schools, Department of Family Services. I'm part of ongoing work groups. My team is part of ongoing work groups and meetings, so we can find positive ways to engage youth in the area. There, a work group, the only thing about work groups is that we have so many in Fairfax. You want to make sure that, because you can go to a group and you're like, man, you're going to 3 different rooms and they're all doing something similar. So there could be some level of like overlap that you don't want to have, but it happens sometimes. Next slide. All right, so these are just a few examples of some things we've done, just to give you a visual. You'll recognize that is me and picture giving that in the back. Stefan is there. And so this is opioid educational town halls. And what we did, I got involved with Stefan and Ellen. We got together and we started doing several opioid town halls where we go out and we address and talk, just like we're doing now, about the realistic things that are going on in Fairfax County. Because I will tell you, one of the things I did strongly agree with this approach, that it directly talked to Fairfax County residents about Fairfax County, right? From a global perspective, but we also made it a very local perspective in what we're doing on the ground floor. And this was just, a part of us. So there were board of supervisors, health department, police department, opioid task force, CSB, all joining together to have these presentations. Next slide, please. So one of I will tell you this, how things kind of come, you'll see how these things kind of run together. So one of the initiatives we did, we had a Real Talk series, right? In our Real Talk series, we would, it spilled over to what we call barbershop, Real Talk barbershop talks, where we would go into the barbershops in local communities and talk about issues that directly impacted the community, right? We had young people, we would have, it was a lot of times men, but we would have youth in the room and gave them just as much say as everyone. We had involvement from the police, local business owners, residents, concerned residents, community voices. There was no bar to who could come and participate in this conversation, which spearheaded into, next slide, us having a community. So we started through that partnership. People wanted to see some action. It was like, what can we do? Talking is great, but what can we do? So we started, and I was like, listen, I don't think we need to do a one-off series. If we're going to do something, it can't be a one-off, because what did I say? That's not an impactful way to do things. So, we started the Community Impact Coalition, and this is becoming a series. We had an event in April, and so we're looking to do something every month. We're going to move to do something, or as many times a year as possible. And what this was a program we had for youth that was for youth that directly impacted them. And we had the police come in and talk about their rights. We talked about what does mental health look like from their perspective, right? For youth, what impacts it? So we explained the three things: stress, anxiety, and depression. What does it mean? What does that look like for you? And have you ever experienced it? And so we had a lot of good conversation with these young people afterwards, because they all wanted to share about things that were going on with them, but they didn't feel like they had a avenue or a way to talk to somebody, because they just weren't comfortable having those discussions. Next slide. And so this is just us. This is what I mentioned earlier, just a picture. This is actually me doing a Boy Scouts of America. I went to their location, their meeting location, and we do several trainings around the county with the Boy Scouts, just so because a lot of what they do is wanting to be in public service. So we wanted to make sure that we were able to, give them the training so they had an understanding when they were talking about, talking to others. Someone I thought I saw in the chat real quick. I'm sorry I didn't get a chance to see it, but part of what we're doing in terms of peers, because I saw about is their peer. So a lot of the young people who are involved in the Boy Scouts now are part of what they're doing is going out talking to their friends, right, on a peer level, to have discussions about opioids, encouraging them to take trainings and kind of have the information so they know what can happen in terms of an overdose and what that looks like. But I'll look at the question in a second, but I promise you, with youth, peer-to-peer is very important. It's very important. You can cover a lot more ground with that. Next slide. All right, so just where we're going with our prevention services to increase our partnership activities for a cross-sectional approach, meaning that all the partners that we kind of had out there is making sure we are consistently working together, trying to build and strengthen community, developing targeted prevention interventions for youth. And that is what I was mentioning kind of all throughout. Nothing about us without us. We want to make sure that as we're developing things, it's not just, me sitting in the room saying, this is what everyone needs and they'll just take it. That doesn't work. Sounds good, but I don't know how impactful or efficient it could be. Making sure we're inclusive of families. One thing I will say with our prevention efforts, we can go out and give the best discussions, talks to young people, but we don't involve their family, then it's kind of like working against the middle, because you don't know what the messages they're going to get when they get home, right? So we want to tie the family in. It is great to approach a young person. It's even better when we can pull the whole family in, because now the whole family is functioning, all right? Because families are smaller communities. We want the communities, to start with the mini community that branches out to the larger community. We can only do that if we pull the whole family together. And continue evaluation of our prevention services. If something's not working, we need to know, right? If we need to make sure the work we're doing is, impactful, effective, and efficient. If it's not, nothing wrong with that. That means we need to go and try something else. Next slide. And just some of our initiatives, I ran through some of these, with someone like Lift Up Virginia. It's about, building that resiliency. Problem gambling, youth gambling, especially at a college level, because they're allowing gambling on college campuses now, is going through the roof, right? It's a whole nother presentation. But one of the things we looked at, because gambling is so normalized, we don't know how it impacts young people. We don't have a plan. So one of my things is to make sure that we have programming that also, when we talk about making good decisions, how do we make that? How do we encourage young people to understand, this could be habit forming. Cannabis and other drugs, we'll be looking at that. Mental health education, definitely focused on anxiety, depression, and stress, because these impact those young people and how to do that. And a lot of that can be done Activate Your Wellness is just it's a social media campaign where it gives you ideas on what can you do, like take a walk, and how do you activate your wellness. Cooking, right? That is something I will tell you before I say this. I am not coming to clean your house. One of the things that helps me relax, I listen to music and I like to clean my house. Again, I'm not coming to clean your house. Don't put that in the chat. Don't stop. Right? But that's my thing. We all have a kind of way to, relax ourselves or take ourselves out into an environment where we feel comfortable and can just tune it down. I never thought cleaning would be my thing. Don't ask that, neither, just happened. Engaging with the most needed communities. Above all, we want to get assistance and services on any level to people who need the most help. That is the overall goal. We can do that, then we can create healthy communities. Next slide. Communities that look like this. Yes, I did put the visual together just for you all. All right. And with that, question.
And before we do go into the questions, I just wanted to say that we did put several slides in our slide deck with resources, examples of some of the community awareness materials we've put out. So that will be available when the slides get posted.
Thank you so much, everyone from Fairfax, for joining us and telling us about your programs. I've gotten a lot of good comments in the chat. Great presentation. Yes, youth support partners can also be a huge difference with this. Please put in your questions. I'm going to start to go through them now. How is the SAPS program funded? I'm loving the sound of this, and I'm wondering if other localities would be able to do something similar in their school. Funding and staffing are typically the barriers.
That's a great question. And so the funding for our substance abuse prevention program comes from two pots of money, if you will. One is Fairfax County Public Schools has dedicated monies to support that program because they recognize that the needs that students have, and then the ongoing opioid crisis needs as well. In addition to that, that program is also funded through our Fairfax County Opioid Task Force. And just full transparency, the program itself was really born out of the Fairfax County Opioid Task Force. They initially funded a portion of the program. And then once the school system saw the benefits of the program, they began to infuse additional money to expand the number of substance abuse prevention specialists that we have.
Very good. And to go on top of that, does FCPS collaborate with other schools or VDOE to share about these programs?
There is a fair amount of collaboration and communication between the school systems, especially in the Northern Virginia area. So for example, when we were looking at the process for acquiring a certain amount of naloxone to stock our schools with, we did reach out to some of our neighboring divisions such as Alexandria and Arlington to see if they were thinking along the same lines, if they already began stocking, what was their sources, that type of thing. We certainly partner with the Virginia Department of Health. They are our primary provider for our naloxone. And I believe the other part of the question was whether or not we communicate with the Virginia Department of Education. There's constant communication with VDOE on a variety of different topics.
Great. Thank you. What strategy would you use to prevent death from fentanyl in fake pills?
I guess I could start that, and then I'll see what Raymond and Stefan would like to add. I mean, I think it really needs to be multi-pronged. I think initially when we started seeing an increase in youth overdoses, there was a thought that, we were talking about that group, some people were kind of as just kind of one profile, but really we've learned that there's all different kind of use patterns for kids who are using fentanyl, some who may not know it's in the pills that they're seeking out and some who might. And so to prevent death from fentanyl and fake pills, it needs to be a multi-pronged strategy, going back to what I said in the beginning, where it's stopping that misuse from ever starting, like Raymond and Stefan's programming, all the way to recovery and harm reduction, lots of treatment initiatives. We have been really kind of highlighting in our communications, our public communications, what the pills look like, how similar they can look to pills that are kind of authentic, that don't have fentanyl in them, how difficult it is to tell the difference. I'll put into the chat, one of our resource pages with that, and the DEA also has some really good materials for that. But we also really need that treatment for kids, because if a kid is using fentanyl, we need to get them into treatment so that they, don't have a fatal overdose. Stefan, Raymond, what would you like to add?
I will say this. I think a lot of times with that, right, I was talking earlier about having the information. One important thing to bring up, especially with a lot of the pills that are being made now, a lot of the pills are being made in someone's garage, right? It's like methamphetamine, it's like stuff is being made in people's garage. Young people don't know this. So this is the thing. You'll say, oh, my friend Brian, gives me, my drugs or whatever. Where does Brian get them from? They don't know, right? They don't ask. Problematic, right? So, and wanting to stop because they think all pills, they think this is a pharmacy, and they don't understand that garage, pills being made in the garage and pills being made at a pharmaceutical company are two different things. They're not thinking about that, but it's having an understanding. You can have 5 pills, right? You can have 5 pills. The first 2 pills may have no fentanyl in them, right? Pill number 3 and 4, they may have enough, but not enough that will harm you. The 5th pill will have something that will take you out. That is not a scare tactic. That is the truth, right? So that truth is helpful for young people, because I will promise you, in a lot of rooms that I'm in there, where youth are in there, once they kind of have that understanding that all things are not made equally, it changes their perception, right? And that's what you want. You want to change the perception that it could be you, right? And what you do, I don't put it to one group of people. It could be anybody. Anybody can get that bad pill. And if you get that bad pill is fatal. That's not a scare tactic. That is the truth. And that kind of messaging, will get out there, because I don't think young people understand. They don't get the gravity of the harm or how dangerous fake pills can be. But those, like I said earlier, it's not about having one conversation. It's about engaging young people in consistent conversations. As adults, we need to be taking responsibility and have those conversations consistently in the school, in the community, and at home. Like Ellen said, I think it's just a multi-pronged approach, but I think that's just one of the ways we have. It's lack of, and you'll be amazed by the lack of information that young people have. They can build computers, build apps, they can tell you all kinds of things, but when it comes to knowing what's out there with these particular type things, having those messages consistently given to them can change perspective, and that's what we want to change. Because changing perspective changes ways of thinking, changes ways of thinking is harm reduction. So that's that's what we want to do. And I'll leave it to Stefan. Yeah,
Yeah, I think Ellen and Raymond did a great job answering that question. The only piece that I would add to it is, the bulk of that question had to do with prevention. And I would say, attend events like this. When you hear of different school events that are occurring around prevention, make it a point to share that information with other people in your community, whether it's other parents or students or whomever, and attend those as well. Your question specifically about fake pills, I would say is one is to do your own research as well and learn to understand some of the differences between real pills and fake pills. For example, a lot of those fake pills, are made and they have various colors, right? Blue, orange, pink, all these different colors of the rainbow, and they look like Skittles. Well, as adults, we know that when we go to the doctor and we get prescribed pills, all of our pills are white, right? They're not designed to make, to attract young people, right? The other thing to be aware of or to be able to tell a fake pill versus a real one is real pills, for the most part, can withstand a good amount of pressure, right? If you push down on them with a spoon or a fork or a knife, it's pretty hard to break them up. Many of these fake pills that contain the fentanyl and some of these other substances that we're talking about, they tend to crumble pretty quickly. So those are just a few of the tidbits.
Okay. We've had some comments related to this question in the chat. One was unfortunate sharing that they just had a student at Virginia Tech who overdosed with cocaine tainted with fentanyl. Life too young. And then another person writes, if a young person really wants a pill, they may not care that it's made in somebody's garage. They may want the pill. They just might want the pill. And and want to do the cocaine because of lack of judgment. Wondering if you've considered fentanyl testing strip distribution like Arlington CSB, which has been shown to prevent overdose.
The fentanyl test strips is something that that FCPS is looking at and looking to purchase and stock our schools with. Yes.
FYI, to answer the question, yes, we currently pass them out. If you take opioid overdose and naloxone training in Fairfax County, when you take it online, whether you take it online or you have us come out, you can request, because it's an individual thing. You can have a request, and we bring it. When we send out Narcan to you, we send the test strips along with you. Also, I put in the chat just now. If you go, it's BTNX. That's where we order the test strips from. If anybody's interested in ordering, I mean, it's not private information or on the code. You can click right on there and have that information. Listen, you're right. I saw the person who said that, like, lack of judgment. They're not going to care. But that also leads when somebody says, when you see someone who doesn't care about something that's potentially harmful to you, then you got to change the questions that you're asking. So what's going on with this young person, right? That they feel so adamant, because it's not just, I want to get high. There's something greater than that. So then we have to change up about our questions. So that brings into the treatment aspect of it. Drug use and substance use a lot of times is the output. There are things that got you there. Some of it is like boredom. Some of it is wanting to engage it with peers. Some of it is, I got some serious mental issues going on that need to be addressed but are not being addressed. I don't know how to. So it's a multi-level kind of thing. But when somebody is at a period where they want to use and they throw all caution to the wind, then we need to change what we're saying, right? What we're saying. So there's prevention, and there's knowing when to engage in treatment. And knowing when to engage in treatment is when you see someone who is, they don't care, right? They don't care because that has something to do with the life. I am saying to you, this could harm you, right? And you're just like, I don't care because whatever I got going on or whatever I'm dealing with. Addiction is a strong thing. It is a strong thing. It is not light, isn't it? Because people say, well, you hear people that say something like, well, why can't they just get off the drugs? It doesn't work like that. If you could just get off the drugs, then addiction wouldn't be possible. I wish I could do a lot of stuff like that. I wish I could snap my fingers, right? I was like, sometimes, unfortunately, I engage in some things I know aren't the healthiest to eat, right? I know. And, I shouldn't. I wish I could snap my fingers and be like, I don't want them. But the draw of it, right? Knowing something is bad, but feeling you can't resist. It is not a simple thing, but consistency is the key. And we have to get involved. And sometimes when young people are saying they have stuff going on and we say, okay, and leave them alone, don't leave your kids alone. My kids tell me they got stuff going on, I sit with them. And that's not about arguing or doing anything. Sometimes when you support somebody, sit next to them. You don't have to say a word. Sit next to them. Sometimes we look for solutions that are up here. Looking up here is the wrong way to look. Looking at our level is the way to look. What do they need right now? They need somebody with them. So yes, I agree wholeheartedly. When young people are making bad decisions, right? Then as the involved person, what can we do differently to support that person? And it's not a one size fits all kind of thing.
How important is the work of the Fairfax County Youth Survey?
So I can speak to that partially. So the Fairfax County Youth Survey, it's extremely important to the work of prevention, right? It is an anonymous behavior survey that allows county leaders and school leaders to really understand the behaviors, both safe and unsafe behaviors that young people engage in. And when we are able to take a look at that data, we're able to determine, what programming is needed, where does funding need to be allocated to support young people and their families to ensure that safe decision making is occurring. And so that survey is very important.
Thank you. Are there any peer supporters connected to the court systems to offer support to youth and families navigating that system? And this person was thinking about the recovery court program.
Yeah, I can talk a little bit about that at a high level. So in Fairfax, we do have 3 specialty dockets. We have a drug court, a veterans court, and a behavioral health docket. And we do have, peer support kind of associated supporting those efforts. Those are, though, focused on adults, individuals 18 and above. So we don't have like a specific drug court for youth right now. We did recently, as one of the strategies that we identified when we started seeing that uptick in youth overdoses, we decided to pursue hiring a youth peer support specialist. And so that was, there were several different twists and turns to make that happen. I believe the team recently was able to fill that position very, very recently. So I think, still getting that online, but absolutely, we would look for all different ways to leverage that youth peer support specialist across, several different initiative areas.
And just a lot of people appreciate the time that you took to come here and share the program that Fairfax County is providing to the community. I certainly appreciate it. And before I finish, there's one last question that I think Charlie, maybe you can help me with too. Someone asked, how do we stay connected with everyone here? There are a lot more Abatement Academy sessions coming up every second and fourth Thursday through the rest of 2023. The Opioid Abatement Authority is also holding 2 in-person sessions. One is going to be September 7th in Abingdon, Virginia, and the other is October 19th in Charlottesville. If you want to email me, jenn@virginia.edu, I can set you up with how to register for these programs, any of the programs, and we'll try to keep you as connected as we possibly can. Thank you again, Ellen, Stefan, Raymond, Brian, thank you for holding up everyone. And I think that's it. Charlie, do you have anything you want to add?
No, I just really want to appreciate Ellen, Stefan, Raymond, Brian, and your team, everything that you guys put together and everything that you're doing out there. Excited to see what else you do. The other mention is if for information from the Opioid Abatement Authority, if you're not already subscribed, if you go to our website, which is www.voaa.us, scroll to the bottom, you'll see a sign up form. You can put your email address in to get our kind of email list stuff. We send out stuff a couple times a month that also keeps people in the loop. But thanks everyone. Thanks to Vig as well for your putting these things together and keeping us running forward.